Hi, my name is Stephanie Best, and I am the supervisor of the Family Preservation Services program at Family Services of NWPA. Family Services is a private, nonprofit, fully accredited social service agency with services for families and individuals in Erie, Crawford, Mercer, Venango, and McCain counties in Pennsylvania. Our mission is to strengthen families and transform lives. Service divisions at Family Services include child welfare services, in-home behavioral health services, school-based services, mentoring and education services, and an outpatient psychiatric clinic. Family Preservation Services are part of the Child Welfare Services Division. Family Services is accredited by the Council on Accreditation, which provides assurance that our services meet best practice standards nationally. Family Services has offices in Erie, Crawford, and Mercer counties. The hours of operation at all main locations are Monday through Friday from 8:30 a.m. to 4:30 p.m. and evenings by appointment. Case managers in Family Preservation Services work flexible hours and schedule sessions based on family need and availability. We have 2 offices in Erie County, including our main office at 5100 Peach Street and our metro office in downtown Erie. The Family Preservation Services team is housed at our main office, and services are conducted in the family's home. Satellite offices are located at Piper Burley Elementary School, McKinley Elementary School, Union City Elementary School, and Union City Junior-Senior High School. Services at satellite offices are provided by appointment only. To learn more about services available at any of our locations, call 814-866-4500. You can also visit our website at www.fsnwpa.org. The Family Preservation Services Program, or FPS, ensures the safety of referred children while working with referred parents to prevent the placement or assist in the reunification of children with their parents or legal guardians. We serve children throughout Erie County ranging in age from birth to 18 whose families are active with Erie County OCY at the ongoing or intake level. To qualify, the child and parent must meet specific conditions. Children can receive FPS if they are at imminent risk of being removed from the home or if they have already been removed from the home. Children in foster care whose placement is at risk of disruption also qualify for services. To receive services, parents must consent to receive FPS. They must also be at imminent risk of having their children removed from their custody or must be expected to be reunified with placed children within 30 days of beginning FPS. We cannot provide services to families receiving similar in-home services from another agency or those where mental health needs require a higher level of care. We also cannot provide services if children are at acute risk of sexual or physical abuse and the perpetrator remains in the home. If the safety of the case manager cannot be ensured, services will not be provided. The Family Preservation Services program at Family Services is an in-home intervention and family treatment program designed to keep children and families safe, prevent the unnecessary out-of-home placement of children, and safely reunify children and families. Components include individual, couple, and family counseling. FPS works to strengthen the adaptive capacity of the family to enhance problem-solving skills, conflict resolution, coping strategies, self-esteem building, and anger management. Parent education is also provided in the individual family sessions in the home. Areas addressed include childhood development, defining realistic expectations of children and adolescents, developing positive parent-child relationships, healthy communication, child behavior management, creating a safe home environment, nutritional needs of children and adolescents, and infant and young child care. FPS case managers work to actively identify and establish working relationships with other service providers. They are knowledgeable about available services and facilitate necessary referrals after consultation with OCY caseworkers. Clients participating in FPS work with their case manager and OCY caseworker to create a treatment plan with clear and measurable goals. Treatment plans are updated every 4 months. Another component of FPS that is available to parents is parent cafes. These are carefully designed, structured discussions that use the principles of adult learning and family support. Through individual, deep self-reflection and peer-to-peer learning, participants explore their strengths, learn about protective factors, and create strategies to improve their lives. The Family Preservation Services program addresses 3 primary concerns: child safety, child well-being, and permanency and/or reunification of children and parents. Services aim to keep children and families safe, prevent the unnecessary out-of-home placement of children, and to safely reunify children and families. Referrals to Family Preservation Services must be generated by OCY. The referral form is used to identify the needs of the family, and those with higher needs may be moved to the top of the list. Referrals can be faxed, emailed, or mailed. To learn more about Family Preservation Services at Family Services, please call 814-866-4500 or visit www.fsnwpa.org.